Hi, my name is Mallory Triplett, and my group partners were Brigit, Croy, and Alexa Olsen. We are part of the Carroll College Nursing Department, and our presentation is called Exercise Your Gut Feeling. Our PICO question is, in adult athletes, does the use of probiotics as supplementation versus the absence of probiotic supplementation improve athletic recovery?
Just some information on the background of our topic. We defined probiotics as live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. We defined athletic recovery as a multifaceted physiological and psychological restorative process relative to time. Another thing to consider is that when athletes do some prolonged stress and exercise, their muscles have increased stress, which just places more stress on their body. And an athlete's body must have the time to recover in order to continue training and to improve in performance. And now dietary supplements such as probiotics are being added to athletes' diets to prevent and manage health issues related to training.
So we looked at a few articles to answer the PICO question. One article that we have looked at is called Probiotic Supplementations Beneficially Affect Tryptophan and Chiurine Metabolism and Reduce the Incidence of Upper Respiratory Tract Infections in Trained Athletes. It was a randomized, double-blind, placebo-controlled trial. So this is a very well-done study. Basically, they took athletes and split them up into a control and a placebo group for 12 weeks, and they tracked the incidence of upper respiratory infections in the group. Athletic performance was not shown to change or increase based off of the supplementation of probiotics. However, the group who was taking the 12-week supplementation of probiotics were found to have a lower frequency of upper respiratory tract infections. The only thing to think about in this study was the symptoms of the URTIs, or upper respiratory tract infections, were subjective. So all of the participants would tell the researchers, or they would document based off of their own symptoms and based off of their own feelings of what they thought could have been an upper respiratory tract infection, which, could have been generally anything. So that's one thing to keep in mind with this study. Another article that we looked at was the probiotic Streptococcus thermophilus FP4 and Bifidobacterium breve. Supplementation attenuates performance and range of motion decrements following muscle damaging exercise. So this was also a double-blind, randomized, placebo-controlled crossover design trial. Essentially, they were trying to see if probiotics have an effect on muscle function, soreness, range of motion, and acute inflammatory response after exercise in adult athletes, specifically male athletes. And in this study, they supplemented for 21 days, and they did find that there was some evidence that showed a greater range of motion, greater muscle function, and lower inflammatory markers following exercise in those subjects who took the Streptococcus and Bifidobacterium breve. Essentially, though, we also would like to keep in mind that this is subjective. It's not always accurate in the general population, so it's something to keep in mind moving forward, but they did find a little incidence of greater range of motion, greater muscle function, and inflammatory markers were decreased, which means athletes moving forward in the recovery period would decrease their recovery time and could enhance that moving forward.
So the third study that we looked at was titled Probiotic Bacillus coagulans GBI 30 6086 reduces exercise-induced muscle damage and increases recovery. This was a case control study, so it was a little lower evidence than the first two that we talked about. But this study compared the effects of one group that had a probiotic administered along with a protein supplement after their exercise versus another group that only had the protein supplement. And this was a process of 7 weeks, and they looked at the outcomes of muscle soreness, recovery, markers for inflammation, and performance testing between the two groups. So the results of this study included Athletes who took the probiotic and protein supplement experienced decreased muscle soreness and increased recovery at 72 hours post-exercise compared to the group that only had the protein supplement. And as Brigit was saying, one thing to keep in mind with this study is the same thing as the other two. The subjects all self-reported their symptoms, and so that's just one limitation that could possibly affect the study. Also, this study had a pretty small sample size too. So they definitely need to get a bigger sample size to see if there would be different results with a bigger sample size. The next study we looked at was titled Lactobacillus fermentum Supplementation in Gastrointestinal and Respiratory Tract Illness Symptoms, a randomized control trial in athletes. This was a level 2 double-blind randomized control trial. And this study looked at the effects of supplementation with Lactobacillus fermentum on upper respiratory tract infections and gastrointestinal symptoms in healthy, physically active athletes over a 15-week training period. So this study did not directly relate to our PICO question, looking at the improving athletic recovery with supplementation of probiotics. This study looked at the URTIs and GI symptoms, which is not necessarily recovery, but since this topic is so new and up and coming in today's society, there's not a ton of research out there yet. So we included this research article because if athletes have fewer upper respiratory tract infections and gastrointestinal symptoms, then we thought that it would help them along in the recovery process. They'd be able to recover better if they don't have these symptoms versus if they do get sick with like the lack of probiotics, then that would enhance, or I guess like take away from their recovery and make them recover slower. So the results of this study were actually unclear. It suggested that males might have a decrease in the severity of GI symptoms, but they did have an increase in the number of incidences when they had probiotic supplementation. And then they did see a little bit of an outcome in the respiratory illnesses. They had 50% less in the probiotic group for males, but all the females in this study, the results were insignificant. So yeah, that was just one thing to keep in mind, is that this study did not directly relate to our PICO question, but we still included it because it was interesting to look at the probiotics effect on those two illnesses.
The fifth article that we brought in for our research was titled Effect of a Probiotic Intake on Oxidant and Antioxidant Parameters in Plasma of Athletes During Intense Exercise Training. This was a level 2 randomized control trial that studied the effect of two different probiotics. The probiotics were Lactobacillus rhamnosus, IMC 501, and Lactobacillus paracosii, IMC 502. These probiotics were used to look at the supplementation on oxidative stress in 12 adult male athletes for 4 weeks during intense physical activity. The 4-week supplementation of probiotics was found to neutralize the oxidative stress levels in athletes during exercise due to the effects of increased plasma antioxidant levels associated with supplementation. So what that means is that the probiotic supplementation didn't necessarily eliminate the oxidative stress levels, but the antioxidant levels that were found in the plasma did help overall. The final article that we brought in was titled Oral Administration of the Probiotic Lactobacillus fermentum VRI-003 and Mucosal Immunity in Endurance Athletes. This was a level 2 double-blind placebo-controlled crossover trial, which in the grand scheme of things is a great setup for a research project, and it evaluated Lactobacillus fermentum supplementation on a respiratory tract infections and mucosal immunity for a 4-month period in 20 elite athletes. The athletes were prophylactically supplemented with PCC, or the Lactobacillus fermentum, and it was associated that a reduction in the number of days and severity of respiratory illnesses in distance athletes was the overall outcome. This can possibly be linked to an enhancement of systemic immunity. And as my other partners have said, this research topic is rather new, and so there isn't a whole lot of information on it. And this article does not specifically relate back to our PICO question, but we still chose to include it because if athletes are struggling with illnesses, they're obviously not performing at their best level.
So we concluded from all of our articles and from all of the evidence that these studies do not definitively support the impact of probiotics on athletic recovery in adults. The articles described that they may suggest an improvement in recovery due to the reduction of upper respiratory tract infections, GI tract symptoms. But like we've already touched on, there was a very small sample of athletes that were studied. There was a lot of dropouts actually in many of the studies, which is also cause for concern in the grand scheme of things. So they did see correlation between muscle range of motion and decrease in inflammation, increase in muscle functioning. But once again, it's just a correlation, and there's not a lot of evidence out there right now in this time period that are supporting the use of probiotics in adult athletes. But it's definitely a topic that we should be aware of in our nursing practice, and that is up and coming information and research.
So to apply this to further practice, we believe that nurses should be aware that adult athletes are supplementing with probiotics to prevent and manage health issues related to training. We also believe that nurses could modify their nutritional education towards athletes to help them in reaching their full potential regarding the use of probiotics.
Another application to nursing practice based off of the studies were that nurses can explore the impact of probiotics on adult athletes in order to better guide patients on this novel supplementation. So as a nurse, we could have patients that come in with questions about this topic, and with this research, we would be able to better answer their questions just by having more knowledge on the topic. And then another application to nursing is that with this research that's available, we could further research using larger sample sizes while continuing the randomized control trials. So as nurses, we can look into further research on this topic and able to get a better understanding of the effects of probiotics to get closer to drawing an actual conclusion on whether the effects of probiotics are beneficial to an athlete who is in recovery or not. Thank you.
Thank you.
Have a great day at SIR.